All across the country, police departments are undergoing training on how to best respond to mental health situations. New tonight, our Hannah Bueller goes for a ride with the Buffalo Police Behavioral Health Team to see how they handle these critically important calls.
And then their immediate needs. A lot of the time they'll tell us what they need in that moment.
Members of the Buffalo Police Behavioral Health Team are on their way to a mental health 911 call in progress.
We assess for harm to self or others. We assess for if they can stay in the community safely.
They don't know what they'll encounter, but this team, made up of 6 Buffalo police officers, 2 lieutenants, and 3 Endeavor health clinicians, are prepared for anything.
Oftentimes, patrol will already get on scene and they will figure out that there's a behavioral health concern or a little bit something more to the call, so they'll request a behavioral health team.
The team is highly trained in crisis intervention. The goal, to identify potential mental health concerns and get a patient the appropriate care, de-escalating any potential danger without jumping to make an arrest or unwillingly send a patient to the hospital.
And the police officer has a role and the clinician has a role. So the clinician knows the background medically, I guess, or clinically of the intervention that might be appropriate for this individual. But we also want to know what we're walking into. What type of criminal history, if any, does this person have?
Captain Amber BEYER leads this team, which started in October of last year. She says BPD is averaging between 7,000 to 8,000 911 calls a year specifically related to a mental health concern. But BEYER believes that call log is even higher.
But as we know, there's some calls that will come out as a domestic disturbance, but then when we get on scene, we realize that an individual in the home suffers from mental illness or substance abuse issues.
Although the Buffalo Police Department has 140 officers trained in crisis intervention, this team of professionals works directly with clinicians and each feed off of each other.
To send a mental health clinician into some of these situations without law enforcement, even when there isn't a high risk of threat, things can shift very rapidly.
Sarah Bork is the program manager for the Police Behavioral Health Team at Endeavor. She says it's important clinicians are paired with law enforcement.
Mental health can be very fluid.
According to Bork, the Behavioral Health Team has a response time of 14 minutes for an in-crisis call and sees the most volume between 12 noon and 3 in the afternoon. Bork says the team has been able to divert a patient from jail on 201 occasions since October.
The most important is the rapport that's able to be built.
According to BPD, the team has only had to use force twice. One time using a bolo wrap device to restrain a person with a knife from causing harm to themselves or others.
The work doesn't stop after that initial call. A big part of BHT's work are in-person follow-ups. Here, connecting a patient to further care or lending an ear to listen is paramount.
Did it feel good talking to somebody?
The compassion, dedication, expertise, and professionalism can be felt by anyone who encounters this boots-on-the-ground team.
Well, it seems like we have a good support system here, too.
And so it's near and dear to my heart, and I think as we talk about mental illness a little bit more, we're realizing that a lot more people are struggling or know somebody who's struggling, and I think that's really important.
In Buffalo, Hannah Bueller, 7 Eyewitness News.